Nina from our city center studios in a short while to just tell us what will be happening, how far is there to finding the white smoke, that proverbial white smoke. We'll also be having Elvis Kosgei live in Mosop in the county of Nandi to just tell us what's happening in matters politics there. Also, Carol Nyeri will be joining us live from the county of Nyeri. She has been doing a spot check on hospitals and health facilities there to just find out what is happening in terms of this strike by the doctors and medical workers. Let's start in the county of Nyeri and let's join Carol Nyeri, who's joining us live from the Nyeri County Referral Hospital to just tell us how things are. Of course, it is the third day of the medical practitioners workers strike. Carol, good afternoon.
Good afternoon, Ben. We are outside the gates of the Nyeri County Referral Hospital, an area that is usually characterized by a buzz of activity, but there is nothing happening here. Day 3 of the strike, still having patients coming by, hoping that there might be some reprieve for them, but being turned away at the gate. As you can see, the gates remain locked. Just very few people who are gaining access, but these people do not include the very citizens or residents of this particular county and beyond who need the services of the medics. We did visit some private hospitals, for example, Madari Hospital. It is a church-based or church-run hospital, and there it is overcrowded because the patients who are not finding the help they need at the public facilities, such as this one at the Nyeri County Referral Hospital, are flocking towards these private hospitals, and of course they are jammed, too much congestion. We're speaking to the chief executive officer, who said that it is quite a challenge that they have to even line mattresses beyond the capacity in the wards so as to assist them. Now, we've just met a gentleman by the name of Peter. He is outside the gates of the Nyeri County Referral Hospital. He was seeking some assistance, but he has told us that he is disappointed he has not gotten the help he needs. Thank you very much, Peter. We are live on KTN News. Kindly step forward. What are the problems you're facing? What had you come to the hospital to do?
I had come because I required a certain letter signed for me by the doctor about the vision, but I found that they were on the strike. So I just went home.
All right, what would your appeal be to the government? Because every person is crying. The residents in every part of the country, in every corner of the country, are appealing for the government, or to the government rather, to expedite, this, hoping to find a solution, a long-lasting solution to end this, because quite a problem for many. What would your appeal be, or your words to the government?
Now, my appeal to the government is that they should take up the matter of owning the hospitals, that remove them away from the county hospitals, because as the county hospitals own them, we are continuing to suffer and suffer very much and much. Innocent lives are really moving away as because of this matter of the counties owning the hospitals. But initially we found that when the government owned the hospitals, there were no such cases experienced. So my appeal to the government is that they should take up the matter of owning the hospitals and remove them from the county
Peter, lastly, before I let you go, I found you outside the gates of the Nyeri County Referral Hospital. You've been here for a while, as you've told me. Have you seen desperate cases come in? What have you experienced in your time here since when you came to the gates hoping to get help?
Now, the gate was actually locked, and some few members, that is citizens who are coming to seek for medical attention, have just gone back home. Yeah. Any
serious cases you've seen?
I've not found any serious cases.
All right. All right. Thank you very much. That was Peter. Thank you, Peter. A resident of Nyeri County. He was hoping to see a doctor at the County Referral Hospital, but he has been turned away, and he's still camping outside the gates, hoping that sooner rather than later he'll be able to get the help he needs. And Ben, we saw yesterday some mattresses being taken from this particular facility. It's a level 5 facility, Government of Kenya mattresses, and we understand they were being taken to some of the private hospitals. Maybe the county government of Nyeri Nyeri also trying to see how best it can bring about relief and reprieve for the patients. But we are still camping, still going around hospitals, both public facilities and private facilities. The situation is dire, that much we can tell you from Nyeri County. So far, no deaths that we know of, except that in Laikipia County, we understand that there are some. But we are still checking the situation, and we'll be keeping you up to date on what is happening. Ben?
Carol, you did mention that a lot of patients are, streaming into private health institutions in Nyeri. What about those who cannot afford the fees at private hospitals? What's happening to them?
Of course, Ben, situation is dire. For those who were accessing services in public facilities, that means that they're not quite able to afford the cost at private hospitals. So it is a strain for the families. I'll give an example. Yesterday, we saw a family that had come to pick a son. The mother had come to pick a son who had been at this hospital for 5 months. Now they had to take him to a hospital, a private hospital in Mwiga. He had been here for 5 months. You can imagine the financial strain. Now imagine looking for money to pay in a private hospital. So some of these relatives, those who picked their patients, their family members who've been patients in public facilities, they're forced to go home, or buy painkillers over the counter, just try to see how they can aid the conditions for their relatives. But those who cannot afford private hospitals, they are going they're going home. And now, Ben, I can see the Minister of Health Nyeri County has just joined us, Dr. Gedenji. Kindly come forward. We are live on KTN News. Thank you very much. This is the CEC in charge of health, Nyeri County, Dr. Gedenji. Thank you very much. I can see you're touring the facilities. Could you bring us to speed from the county government side? What comments would you have to say regarding this situation?
Okay. Well, as all of you know, this is a nationwide strike of doctors and nurses. And here in the county government of Nyeri, in the Nyeri County, we are neither spared. As you can see, our hospital here is deserted. This is our referral hospital. However, we, as a county government, we've made arrangements with especially the faith-based healthcare providers here. We have Madhari, Tumutumu, Immaculate in Kieni. And what we've done to alleviate the suffering of the people of Nyeri is that we have an agreement with the faith-based healthcare providers to the extent of assisting them with medical supplies. We've done so for Madhari, where we have taken 20 beds with the linen, plus the incubators for children. We've also asked them to give us the needs in terms of medical supplies, drugs, surgicals, and such. And therefore, we're working closely. We've asked them also to subsidize for the cost of healthcare. Because again, we are going to...
Yeah, of course, that is very important, because there are those relatives who picked their members or their loved ones from the public hospitals, and they took them home because they're saying they cannot afford the care. So it is good to hear that the county government is pleading or asking the private hospitals to subsidize the cost. Perhaps any other measures?
Well, again, we've been able to transfer all the patients, even those that were unable to access the services in those hospitals we are talking about. We had like 3 cases, and we've been able to talk with them as the Department of Health to the effect that they take them in, and if they have difficulties, we'll agree on how to settle those bills.
Any deaths so far that you know of?
Fortunately for Nyeri, we've not recorded death in our hospitals. We were able to evacuate them in time, and therefore we've not had death yet.
Thank you very much, Dr. Gedenji. Thank you very much for your time on KTN News. All right. Thank you. All right. Thank you. We'll join you later. Ben, we've been talking to Dr. Charles Gedenji. He is the CEC in charge of health in Nyeri County, stating some of the measures that the county government of Nyeri has taken to alleviate the situation, taking beds and medical supplies to private hospitals, especially the church-based ones, and appealing to them to subsidize the costs so that those who have moved from public hospitals will be able to pay for the medical services in the private hospitals. Ben.
Thank you, Carol. Carol and Derry, they are reporting.